Welcome to this video on communication skills and public speaking, part of our Behavioral Sciences Medical Education series designed for BDS and MBBS students. Why does communication matter? When doctors and patients struggle to understand each other, it can lead to medical errors, dissatisfaction, and even litigation. Effective communication, however, builds trust and ensures better care and patient satisfaction. In this video, we will cover the core principles of effective communication in clinical practice, including active listening, questioning techniques, and how to overcome common communication barriers. Section 1 focuses on communication skills, which are essential for establishing a solid foundation for the doctor-patient relationship through the effective exchange of information. What exactly are communication skills? They are the tools that allow us to convey information efficiently. As the saying goes, half my illness was relieved after talking to my doctor. These skills help build rapport, improve diagnosis, and ensure treatment compliance. Effective communication relies on several key principles: attending, listening, active listening, using the right verbal techniques, demonstrating empathy, and checking for mutual understanding. Attending is the art of truly focusing on your patient. This requires giving your full cognitive attention, engaging in one-on-one interaction, and actively managing the environment to remove distractions. Conversely, poor attending includes behaviors such as checking your phone or smartwatch during consultations, multitasking by organizing files or eating, and allowing constant interruptions. Take a moment to reflect. How would you feel if your doctor kept checking their phone while you were trying to talk about your pain? Active listening goes beyond just the words spoken. We must also pay attention to paralinguistic cues, like tone and pitch, as well as nonverbal cues, such as the patient's posture and facial expressions. When comparing linguistic and paralinguistic communication, remember that linguistics focuses on what is said, while paralinguistics, such as tone and pauses, helps us understand how it is said, providing essential contextual meaning. To read body language effectively, observe facial cues, eye contact, posture, and proximity. Keep in mind that body language is a clue, not a diagnosis, so always validate what you observe with a question. Factors that improve communication include maintaining a relaxed posture, consistent eye contact, an open body position, leaning slightly forward to show engagement, and listening specifically for the patient's feelings. Conversely, barriers like lack of privacy, biased remarks, selective listening, high anxiety, and internal distractions can obstruct communication and lead to diagnostic failure. To wrap up, remember these core verbal techniques: using effective questions, funneling information from broad to specific, paraphrasing, selective reflection of emotions, building empathy, and checking for understanding. Let's explore questioning techniques, starting with closed questions. These are fixed response questions typically answerable with a simple yes or no. They are highly effective for rapid data collection, such as during emergency triage, gathering demographic information, or confirming specific symptoms. In contrast, open-ended questions are the gold standard for exploratory conversation. They encourage the patient to elaborate, helping you uncover underlying concerns and hidden agendas that a simple yes or no would miss. Avoid leading questions, which suggest a specific answer and can bias your findings. For example, instead of asking if pain radiates to the left arm, which forces a patient to agree, ask, "Where else do you feel this pain?" to allow for authentic, patient-led exploration. Follow the golden rule of questioning. Prioritize what, when, where, and how to keep the conversation objective. Try to avoid using why questions too frequently, as they can inadvertently sound accusatory or judgmental to the patient. Use the funneling technique to manage information flow. Start with broad, open-ended questions to capture the patient's full story, then gradually narrow down to specific, closed questions to collect the necessary clinical details. Paraphrasing is another powerful tool. By restating the patient's words, such as saying, "You feel tired after walking a short distance, is that correct?" You provide clarification, ensure the accuracy of your clinical notes, and build trust by demonstrating that you are truly listening. Selective reflection involves focusing on the emotional content behind a patient's statement. When a patient mentions distress, asking how it feels to live with that limitation helps explore the emotional burden of the disease and strengthens your therapeutic alliance. Building empathy is essential for compassionate care. True empathy is the cognitive and emotional ability to enter the patient's shoes, allowing you to provide support that is rooted in genuine understanding rather than just pity. While sympathy is about feeling for someone, Empathy is about feeling with them. Empathy requires active engagement and perspective taking, which is vital for effective medical practice. Finally, always close the loop by checking for understanding. Summarize the conversation, invite the patient to confirm if anything was missed, and ensure you have reached a shared goal regarding their treatment plan. Think about these scenarios. Do you smoke? Is a closed question. What is it like at home? Is open-ended. You aren't worried, are you? Is a leading question. Mastering these distinctions will improve your daily clinical communication. Moving to our second section, let's discuss public speaking. Mastering this skill is crucial for healthcare professionals, especially when providing health education, delivering professional presentations, or leading community counseling sessions. Developing public speaking skills offers significant benefits for doctors. It boosts your personal confidence, builds professional credibility, and establishes you as a leader within your medical community. In public speaking, do prioritize clarity and meaningful pauses. Keep your message organized. Maintain consistent eye contact with your audience, and actively encourage interaction and participation. Avoid the common don'ts of public speaking. Do not read directly from your slides, avoid speaking in a monotone, minimize filler words like or and never become defensive if challenged by your audience. Managing stage fright is a common hurdle, but preparation is the cure. Incorporate deep breathing to calm your nervous system, use positive self-talk to reinforce your expertise, make eye contact to connect with friendly faces, and ensure you complete at least 3 full rehearsals before you present. The effective speaker formula is about combining your solid medical expertise with the mastery of communication techniques. This synthesis is what transforms clinical knowledge into clear, actionable advice. Let's put this into practice with a quick pair activity. In pairs, one student will explain a toothbrushing technique, while the second student observes their verbal and nonverbal cues. Swap roles after 2 minutes to experience both sides of the interaction. Our take-home messages are clear. Communication is a trainable clinical skill. You must learn to listen deeply before you speak, and remember that empathy is proven to improve clinical outcomes. Effective communication is truly therapeutic. Thank you for your active participation throughout this session. If you have any remaining questions, please feel free to review the materials provided. For further study, you can refer to these resources and image sources, which have provided the visual and technical data used in this video. This concludes our video on communication skills and public speaking. We hope these strategies assist you in your journey toward becoming a more effective and empathetic medical professional.